Moving to the last part of this video, which discusses some skin cancers, and we're going to compare between these cancers regarding to how likely the cancer will metastasize and how likely to even occur. Starting with our first cancer, which is basal cell carcinoma, and this is the most common skin cancer to occur, but it really rarely metastasizes. The least one expected to metastasize among skin cancer is the basal cell carcinoma. You can find basal cell carcinoma in the sun exposed areas such as the face and the upper lip. It is very important to memorize that it can be found in the upper lip, and you have to compare it with the squamous cell carcinoma, which can you find on the lower lip. It is very important to remember this. Now, the general appearance of the basal cell carcinoma can be summarized by saying it is a pearly nodules. Pearly is the fancy word to say shiny. It is simply a shiny. You can find it and you can notice it just right here. It is shiny nodules on the skin, and pearly or shiny is a keyword that can help you in your examination to understand that we are talking about basal cell carcinoma. Now we have two variants of this of the basal cell carcinoma shown right here. It is either present with these rolled borders and ulcerative central this way, or it is just a normal flat lesion or flat plaque just right here, and this we call it the rolled borders, and we call it the superficial basal cell carcinoma. Now, the superficial basal cell carcinoma cannot be easily distinguished from other dermatological conditions, but the clues and the history of the patient gonna give you an indicator that we are talking about basal cell carcinoma, so that it is either a rolled borders or it is a scaling plaques and superficial basal cell carcinoma. And the last thing to talk about is the histopathology for basal cell carcinoma, which is the palisading nuclei. They are nuclei that lining each other. Now, to understand this, imagine we are talking here about a keratinocyte. Now, normally you're gonna find the nucleus in the center, but in the case of the basal cell carcinoma, you're gonna find it in the edge of the keratinocyte this way, just this way. Now, the other keratinocyte beside it will have the same location of the nucleus, which is at the edge of the keratinocyte. Now the nuclei will present as they are lining beside each other, and we can illustrate it here. This is what we call the palisading nuclei. The nuclei are forming line, and they are lining beside each other in this way, and this we call it palisading nuclei, which gonna help you in the diagnosis of the basal cell carcinoma. Now, moving to our second skin cancer, which is the squamous cell carcinoma. This is the second most common skin cancer, but it rarely metastasizes, but it is likely to metastasize more than BCC, more than basal cell carcinoma. So that it is the second most skin cancer, and it is more likely to metastasize than basal cell carcinoma, but still it rarely metastasizes. It is important to understand the association of the squamous cell carcinoma, which are the sun exposure, the chronic non-healing wounds, and the immunosuppressions such as HIV or organ transplants patients and arsenic exposure. We really don't find a lot of cases of arsenic mediated squamous cell carcinoma, but it used to be a significant reason for squamous cell carcinoma, especially the arsenic from a contaminated water. Now, regarding to the location of the squamous cell carcinoma, the face and the lower lip, remember what I have told you, that the basal cell carcinoma will happen in the upper lip, but the squamous cell carcinoma will happen in the lower lip, and it's very important to distinguish the two cancers and the two locations, and the ear and the neck. The appearance, it is not very hard, or it is not very unique appearance. It is just these red ulcerative lesions you can find just right here and right here. What is very important to understand and recognize is the histopathology. In the histopathology of the squamous cell carcinoma, we have this accumulation of the keratin, and we call it the keratin pearls. It is very unique. unique and very beautiful and very easy to memorize it and recognize it in your examination. The keratin peels are also are always associated with squamous cell carcinoma. The last thing to talk about squamous cell carcinoma is the pre-malignant lesion. We have a dermatological condition we call the actin keratosis, and now actin keratosis is a pre-malignant lesion for squamous cell carcinoma. It's just erythematous and rough plaque, and it is also associated with sun exposure, which should make sense to you because also squamous cell carcinoma is associated with sun exposure.